Future Career Decisions Part 1. You see and hear more in a short period than you ever imagined, and most of what you see and hear cannot be shared with anyone outside of the immediate setting. Nursing can be a very maturing experience. It changes you. This shows you the 3 R's of the psychobehavior role of the nurse. In an effort to improve the transition from graduate to the work environment, NCSBN developed the Transition to Practice model. It's still in the testing stages at this point, but the goal is to improve retention and patient outcomes. A preceptor will assist a new graduate, but again, this is still being studied and evaluated. Clinical reasoning and safety is woven into the practice experience, and after 1 year of practice, the new graduates will have to provide their board of nursing with a transition to practice verification form that is signed by the graduate, preceptor, and supervisor. The LPN must also find healthy ways to relieve stress at the end of the shift that will not contribute to his or her personal health problems. Traditionally, healthcare was based on diagnosis and treatment of illnesses and conditions, but more healthcare opportunities are now available. Again, the Omnibus Budget Reconciliation Act of 1987 mandated that all skilled nursing facilities and intermediate care facilities provide 24-hour LPN care 7 days a week, with at least 1 RN employed 8 hours per day, 7 days per week. More staff is needed in facilities that have fragile residents and those with Alzheimer's and other dementias. In home health nursing, treatments that patients require in the home can be too complex for the home health aide, so the job opportunities in home health care are increasing steadily. Again, home health has successfully reduced the overall cost of health care in the United States. There's job opportunities in mental health nursing, where LPNs are involved in performing treatments, administering medications, and tending to activities of daily living. The LPN plays a significant role in developing therapeutic relationships with patients and following the interventions that are established by the registered nurse. Mental health facilities practice a team concept in which everyone is expected to know the therapeutic guidelines in a patient care plan and carry out the plan. In the military service, some skills and personal characteristics would be that you have an interest in teamwork, you have a strong ego, and you can cope with changing situations. You're emotionally stable, you're self-directed, you have a desire for adventure, you're flexible and adaptable. Currently, 1 in 8 hospital nursing positions is unfilled. Again, know your scope of practice. Make sure that you review your job description and be assertive. The skills and personal characteristics for hospital nursing would be a strong technical organizational skill, critical thinking skills, a strong ego, the ability to handle emergencies, the ability to work on a team, and to know your own limits and know when to ask for help. With outpatient clinics or doctor's offices, etc., this type of work may require some cross-training for lab or x-ray or clerical, etc. Some of the skills and personal characteristics required for this type of work would be good communication skills, attention to detail, enjoying routine, organizational skills, critical thinking skills, being self-directed, and being personable. Operating room nursing. Remember that technicians are often hired as, quote, OR nurses, but they don't have any nursing training. Skills and personal characteristics for OR nursing would be stress management, separate personal and professional feedback, a sense of self-worth, following directions, handling emergencies, and a willingness to learn. At the VA, you don't have to be a veteran to apply for employment. Salary rates at the VA are based on the grade, performance, and promotion to higher grades, overtime, and shift differential. In hospice, hospice seeks to improve the quality of life over the quantity of life. So if a client is hurting, for example, the nurse will provide the medication required to ease the pain, regardless of the client's job opportunities. To accomplish the goals set in each one of these jobs, it is important for the nurse to be comfortable with his or her nursing skills and innovative in the provision of care. Additional responsibilities for employment to consider include residential treatment centers, medical management companies, state, federal, or private prison systems, corporate short or long-term disability benefit administration case manager, daycare centers for adults and children, weight loss clinics, social service agencies, ambulance and emergency medicine staff, the dentist's office, a blood bank, substance abuse clinics, schools, adult daycare, welfare and religious organizations. And with religious organizations, if you're not familiar with those, some churches hire nurses to visit their congregation or parishioners, and they are called parish nurses. Specialized mobile units, fitness centers, VISTA or the Peace Corps, and certified hearing instrument dispenser.